I am back with another video on pathology, and in this video I will be discussing endocarditis. So by the name we can say that this is the inflammation of the endocardium. Okay, inflammation. Why? Because the name ends with the itis. Okay, itis. So that's why we call it as a inflammation, and inflammation of endocardium. Okay, so uh, inflammation of endocardium that lines the surface of cardiac valves. Okay, and it is usually due to bacterial infection. So guys, the first bacteria which causes this endocarditis is the Streptococcus viridans. Okay, so this is the most common overall valve cause of this endocarditis, and it is low virulence organism. Now, what do I mean by the low virulence organism? So guys, low means less, okay, and virulence means the capacity of the bacteria to cause disease. So this this bacteria has very less capacity to cause the disease, okay, and it usually infects the previously infected valves, okay, like from the acute rheumatic fever, or we say that the matellar prolapse or something like that. If the person has undergone that disease, then this S virus is most likely to be get affected in the individual. Okay, now, and it reflects in small vegetations that donate in destroying valve. Okay, so guys, what is the pathogenesis of the endocarditis? Guys, as you all know that all the hallmarks of the inflammation are seen in this disorder. Okay, so there is damage to the endothelium lining the endocardium. Okay, and the sub collagen, it gets exposed to the blood, so the platelet and the fibrin, they get deposited in the area, causing the thrombotic vegetations. Okay, and if the bacteria is coming from the blood into this area, then we call it as a endocarditis. Okay, transient bacteria leads to trapping of blood in vegetations. Okay, and that and that and that is called endocarditis. So the next bacteria which we are going to discuss is the S aureus. So this is the most common cause in IV drug abusers, the person who take the drugs via the intravenous pathway. They are likely to develop endocarditis, which is caused by this S. aureus. Okay, and this bacteria is high virulence organism, and it infects normal valve, tricuspid valve, unlike S. viridans, which infects the damaged valves. Okay, and this results in large vegetation that destroy valve, which we call the acute endocarditis. Okay, so the next question that comes in board exams is the S. epidermidis. Okay, this bacteria is usually involved in the endocarditis of the prosthetic valves. Okay, so guys, next bacteria which we are going to discuss is the S. bovis. So so this bacteria causes endocarditis in patients with the underlying colorectal carcinoma. Okay, so guys, if we do the blood culture of the valves, okay, and if you find no no organisms which we have discussed previously, like S. viridans or S. aureus or S. epidermidis or S. bovis, then we can think of this organism. The acronym for this organism is the HASIC. Okay, so H stands for the Haemophilus influenzae, A for the Actinobacillus, C for the Cardiobacterium, E for the Eikenella, and K for the Kingella. Okay, so so if the patient has endocarditis and the blood, and if we and when we do the blood culture, and the blood culture does not show any kind of a S aureus or S epidermidis or S bovis or S viridans, then we can think of this five likely organisms which can cause endocarditis. Now, coming to the laboratory findings, so in case of positive blood culture, we get anemia of a chronic disease, usually microcytic anemia with less TIBC, that is total iron binding capacity, less serum iron, and more ferritin in the body. Okay, and the procedure by which we can find that the person has this disorder is the transesophageal echocardiogram. Okay, so whatever we have taught in our previous slides was a bacterial infection which caused the endocarditis, but now we are going to talk about the non-bacterial thrombotic endocarditis. So in this state, the sterile vegetation that arises with a hypercoagulable state or underlying adenocarcinoma. Okay, and vegetation arise on mitral valve along lines of closure and resulting in regurgitation. Now, moving on to the last type of the endocarditis, it is the Liebman-Sachs endocarditis. So, this is associated with the SI, that is a systemic lupus erythematosus. Yeah. So in this case, vegetations present on surface and under surface both sides of mitral valve, and this causes mitral valve re regurgitation. Okay, so that is it for today, guys, and thank you for watching, and remember to subscribe कर जल्दी, ठीक है?